our first guest is a long time, very committed. We talk about people who are so committed to our community. Dr. Robert Hartzell. Dr. Hartzell, are you on the line?
Yes, I am. Can you hear me okay?
I can hear you perfect. JR, you just jumped.
Oh, yeah, I did. I heard the speaker go off.
It's so funny when you're doing call-ins, how that's all going to work out. So sometimes, the stars are in a line, and we actually have somebody come across on the telephone. So welcome,
Happy.
Dr. Hartzell. How are you?
Thank you. I'm doing very well. Thank you.
We were just talking about people who are committed to our community, and to introduce you, I know you're actually a native Floridian. You're not even a long resident. You're a native, and you've been in Hernando County for many, many years. So,
Yeah.
How many many's?
Since 1988.
1988. So, and thank you very much, because I know that you and your family are here, and you do have a big commitment to Florida, and of course to Hernando County, and you are board certified in urgent care. Correct?
Yes, ma'am.
So what else would you like to share with our listeners that about yourself and as far as your passion for our community and, of course, for healthcare?
Oh, let's see. I'm originally from Newport Richey, and I moved up to Hernando County after I finished my training. There was a good opportunity. I can remember, in my younger days playing sports, coming up here and playing basketball and different things, and I always thought it was kind of a neat place. My hobbies are I like to fish and hunt and hike, and that gives us plenty of opportunities to do that.
You are in the right state.
Yes, absolutely. And as far as medical, when I first came to town, there was myself, another family practice doctor, and one pediatrician. And I started out, I did newborn nursery, did all ages. And just to see the transformation over the last 30 years is just incredible. Now we have big major teaching hospitals in the area and residency programs and all kinds of medical students. And I think medicine has come just a tremendous, a long way since I started in 1988, and I can't wait to see what it's going to do in the future.
That's very exciting to have been here for that long, to experience the growth in Hernando County. Not only as far as in residential and, of course, in business, but, of course, in healthcare, and to think that you have been involved in every step of the way. So congratulations. And, again, I can't thank you enough for that commitment to our community. So
thank you.
You're welcome. And it's really funny. As long as I've been with the Chamber, I don't think our paths have ever crossed. So we'll have to make sure that happens at some point in time. So you've been with Access since when?
2008.
Okay. Wonderful, wonderful group of doctors and spearhead by, obviously, Dr. Singh. And,
Yes.
If you go on the website, which is, I don't have it on the top of my head, but I just Googled Access Healthcare Hernando County. I was impressed by how many physicians and people like yourself who've been in the community for quite some time who are now working under the Access Health umbrella, which is wonderful, because what happens, I know you work in tandem with each other and refer each other. So to have that area of specialists who you can work with, that you've worked with for many, many years, to be able to refer your patient to is probably a very, very wonderful thing for you to know that you're referring to somebody that you've known for a long time.
Right. I think it's good for the patient as well as the doctors.
Yes, and I've had the opportunity to meet some young doctors who are coming into your into that practice, which is really nice. And I'm sure you've had that opportunity to spend some time with them, to be able to see the future of healthcare working with these young people. I think that's very exciting.
Oh yeah, I think the future of healthcare in Hernando County is just unlimited. It's like I had mentioned with the residency programs and all the medical students coming here. A certain percentage of them will stay, and I think the people of Hernando County will be taken care of very well medically from here on out.
Very, very much so. So, Doctor, are you still located on 11479 Cortez Boulevard? Is that where your office is? Okay. And I wanted to share this with everyone, and the phone number there is 352-597-3511.
Yes.
So your primary, I would say, because you're a family medicine, would be, is it Medicare? Is it people who are over the age of?
Yes.
Okay.
Our practice consists really 100% Medicare and Medicare products, like the Medicare HMOs. And that's what we do.
And I think you do it well. I think that, as I said, Access has that umbrella of all of the primaries and, of course, the specialists to be able for a person who is on Medicare to be able to go into their retirement lives, with excellent health care. And I really thank you so much for being part of that team. Let's talk about how COVID, and I know this is kind of an overly discussed topic, but I don't think it could be discussed enough or brought to a presence of mind of how it's impacted your practice.
Well, it's impacted it tremendously. As we speak right now, we're just doing telemedicine. We're not seeing any live patients face-to-face. And I miss that, and the patients have expressed that they miss that. And it kind of limits you on what you can do, as you can imagine, over the phone. But it seems to be we're making the best out of a bad situation, I guess you could sort of say.
Well, again, it's wonderful to be working in tandem with so many physicians and, of course, your administration and your PAs as far as a team to be able to, be there for your patients and to help them through this very, very challenging time. And so I think that having so many people within the facility, there's an opportunity for everyone to work together to make sure the patients are taken care of.
Yes.
So one of the things I think that was mentioned to me was your interest or your knowledge as far as liver enzymes. Did you want to touch upon that before we wrap this program up?
Yeah. So many people come in to go over their blood work, or we go over the phone with them, and most people don't know exactly what the liver enzymes are. And if you look on your lab report, there's that one section kind of down below at the bottom of the complete metabolic profile that'll say alkaline phosphatase, bilirubin, AST, ALT, and that's your liver function. And so many things can affect the liver. Really, what I'd like to just touch on first, we're talking about liver functions, but kind of just mention, what the liver is and where it is and what it does. The liver happens to be the largest solid organ in your body. It's roughly about 3 pounds, about the size of a football. There's 2 lobes to the liver. The right's bigger than the left lobe, and it's separated by a ligament called a falciform ligament. And the individual cells, working healthy cells of the liver, are called hepatocytes. But the liver works to help detoxify and purify the blood. It helps remove, toxins that we may take in from the bloodstream. It helps store vitamins and minerals such as iron and copper, and is able to release them as we need them. It helps break down fats, helps with digestion in our diet. It can also, it either stores the fats or releases them as energy. And also it manufactures bile that the small intestines use to help digest fats even further. It helps break down different proteins. It also helps break down alcohol and medications. It also helps create proteins that are responsible for clotting. So when you cut yourself, you don't bleed to death. It also helps our immune system. It stores excessive blood sugar. And it can even break down old and damaged red blood cells. But to me, the one thing that is amazing about the liver, you can, a week after surgery, say if somebody had 2/3 of their liver removed, it's roughly the same size a week later after surgery. It can regenerate itself. Not to say if you keep injuring your liver in different ways, eventually that can lead to liver failure and death, but for a while it can just continue to regenerate itself.
So let me ask this one question. As far as what can one do, whether it be as far as a supplement and or eating correctly to, because obviously the liver is one of the organs that purifies, to help that liver stay healthy?
Well, you can avoid alcohol. You can lose weight, decrease your calories. You can reduce the amount of cholesterol you eat. Stay away from the saturated fats, the trans fats. You can avoid smoking. Exercise regularly. Increase your folic acid. Eat more veggies, fiber. Eat more asparagus, avocados, spinach, lettuce, things like that.
Greens.
Greens, yes.
Supplements?
Supplements, some people, one is garlic's good for your liver. Turmeric's good for your liver. Milk thistle helps detoxify your liver. Green tea is good for your liver. And even the one I like is coffee. Drinking 2 to 3 cups of coffee a day is actually good for your liver. And they're not real sure if that's the caffeine or the antioxidants in the coffee. But, you want to make sure you get plenty of potassium, B6, folic acid. You kind of just, it sounds like common sense, but, it's just healthy eating, I guess. Try,
yeah.
If you can afford it, eat more organic foods. Supposedly there's less toxins in organic foods. And just, a well-balanced, healthy diet, just like you should for a lot of things, is the best for your liver.
Well, doctor, again, I'm sure anybody who would like additional information on, as far as to how to have a healthy liver and maintain a healthy liver, and of course, to speak with you and do a consult with you, they can contact you at the 597-3511 phone number, correct?
Yes, ma'am. That'd be great.
Thank you very much, doctor. We appreciate you joining us today, and of course, your commitment to our community, and thank you again.
Thank you. I'd like to thank Chamber of Commerce, Access Healthcare, and WWJB.
Thank
you very much.
Okay.
Have a great day.
You too. Bye.
Bye-bye.